Our first video is presented by Dr. Kenneth Steinhoff. Dr. Steinhoff received his medical degree from Hahnemann University and completed his internship, psychiatry residency, and child and adolescent fellowship at the University of California, Irvine. He's currently an associate clinical professor at the University of California's Irvine Child Development Center. How ADHD affects children and teens. What is ADHD and how prevalent is it among children and teens?
ADHD is short for Attention Deficit Hyperactivity Disorder. This is a well-defined medical condition that is diagnosed as many other medical conditions based on symptoms. People with ADHD have one of three types. The hyperactive impulsive type, with symptoms such as fidgeting, restlessness, interrupting, talking too much. Or the second type is the inattentive type, which used to be called ADD, with symptoms such as difficulty concentrating and focusing, easy distraction. They may have the third type, which is a combination of the first two. ADHD affects about 5 to 10% of the school-age population in America. It's not fully understood why, but ADHD is diagnosed about 3 to 4 times more often in boys than in girls. This is probably because boys tend to be hyperactive, while girls tend to be more inattentive and therefore less obvious.
What kinds of negative consequences can there be if a child's ADHD is left untreated? How can it affect their ability to perform at school?
Well, if a child's ADHD goes undiagnosed and therefore untreated, any number of negative consequences can result. That child will likely have difficulty concentrating in class and may have noticeably impaired reading, writing, and math skills. Unfortunately, children with untreated ADHD also are more likely to repeat grades, possibly be suspended or even expelled. Untreated ADHD can also cause some emotional and social problems for children and teens, including difficulty making friends, various aggressive and defiant behaviors, and continued conflicts at home.
How is ADHD different for teens than for younger children?
Well, although ADHD persists into adolescence, it can be a different experience for teens than it is for younger children. Often, hyperactivity declines as children mature, while difficulty focusing, following directions, and finishing tasks may persist or even get worse. Teens also face greater social and academic pressures like preparing for college, entering the workforce, dating, a busier social schedule, and even driving, among other things. These added responsibilities and pressures may make some ADHD symptoms more apparent. It also makes it more important than ever for teens to manage their ADHD symptoms. There's just more at stake.
What is usually the most pressing concern for parents of children with ADHD?
A school is usually the parent's primary concern for their child with ADHD. They worry that ADHD is affecting their child's grades or their child's ability to keep track of or even get their work done. In fact, it is most commonly a child's difficulties in school that motivate parents to seek evaluation and to consider treatment. In addition to school performance, many parents are concerned about the negative effect ADHD can have on their child's relationships, on social acceptance, and on their child's self-esteem. In my experience, another big worry for parents is the idea of having their child evaluated. They fear their child might be labeled or stigmatized. Actually, a careful evaluation is often a relief and usually identifies a number of interventions that can be very helpful both to the parents and to the child.
Is there a cure for ADHD? Can ADHD be treated successfully?
While there is no cure for ADHD, it is manageable. It is usually recommended that patients have a comprehensive management plan which utilizes a combination of medication and various behavior modification tools. In fact, the American Academy of Pediatrics recommends this type of program approach for the treatment of ADHD. The good news is that with an effective treatment program in place, people with ADHD can better manage their symptoms.
Can a medication like Concerta help improve academic performance?
Well, when it comes to choosing a medicine for your child, it's important to discuss all your options with your child's physician. One of these options is Concerta. Concerta offers patients and parents proven symptom management and convenient once-a-day dosing with a continuous release of medicine throughout the day. In fact, Research indicates that Concerta can help improve academic performance in children with ADHD. It helps reduce inattention, hyperactivity, and impulsivity, which may help these children concentrate in class and focus on homework and their assignments. In addition, Concerta helps reduce disruptive and inappropriate behavior both in school and out of school. This may give children more control over their actions and the ability to consider choices rather than just acting impulsively. This can have a positive effect on your child's friendships and on your child's social skills.